Hey, this is Doug Field along with my co-host Brent Macy, and welcome back to the segment of Healthcare Consumerism Radio. And on this segment, we're going to talk about integrating benefits, wellness, and voluntary products. And actually, what's the broker role? I mean, there's a lot of question marks out there that are being asked about what is the broker's role in this changing environment. And joining us to talk about this and much more is Bart Sheeler, CEO of GoFirst Solutions. Good morning, Bart. How are you?
Hi, Doug. Hi, Brent. How are you guys?
We're doing good. How about yourself?
Doing real well. Lots of snow in Ohio this winter, but it's all fun.
Yeah, you guys have gotten hit pretty much. Hey, give our audience I know this is your new venture. You've got a pretty good track record in this space as an entrepreneur. Tell us about GoFirst, and then let's talk specifically about some other elements here, trends in the market, okay?
Yes, sure. So a little background about me. I live in Cincinnati with my wife, Jennifer. I have two boys, Brandon, a minor league baseball umpire.
Go Bucks.
And Bryce, yeah. And a high school senior that plans to study engineering. Way back when I got my undergraduate degree and an MBA, both from the University of Dayton, where I focused on business management and marketing. In '98, I co-founded Active Health with 4 other folks and served as CEO, which led to an acquisition by Nurture Health back in January of 2010. One of my most proud accomplishments was creating an exclusive partnership with Duke University's Center for Living, who became a long-standing and trusted partner, a relationship that I really enjoyed for over 15 years. While at Active Health, we built an online platform called the PhD Network. It was delivered personalized education program, individuals based on risk factors and lifestyle traits identified during the health assessment, included educational lessons developed by the experts at Duke, and included other things like goal-setting tools, program tracking, and incentive point management, all within one health management platform. But after spending 15 years on the inside of the wellness industry, about 6 months ago, I went back out on my own, decided to move back into the market independently to help small and mid-market employers and brokers understanding the value of integrating typical wellness initiatives with overall benefits design and new solutions like telemedicine, all to improve program outcomes and save insured employers on health plan costs. So today I'm kind of excited about being able to talk about how all this can fit together for the common good.
Yeah, talk to us about the broker's role that you see it going forward. The way you were on the program earlier, I'm speaking to a group of brokers in Houston on Monday, and their whole theme of their event is operating in the new normal. So, smart brokers are trying to figure it out. So what do you see the broker's role going forward?
Sure. So brokers can be a tremendous resource in the overall benefit design process. A lot of this has been done in separate silos over the years, and involving brokers in strategic discussions and reviewing the products that they bring to the table as part of the process, and not just add-ons reviewed with employees during open enrollment. That would go a long way in the development of fully integrated health, wellness, and benefits-driven programs. Using wellness programs and incentives in support of high-deductible health plans, brokers understand how that can work, but the small and mid-sized groups may not. And using them as the local expert to help drive some of those strategic discussions can make a real big difference. For example, achievement of certain goals or rewards could trigger additional contributions from the employer into the employee's health savings account, or could even subsidize voluntary benefits like vision or dental programs. Brokers, they offer several new employer-paid and voluntary products as well, and if properly promoted, they can lower self-insured plan costs too.
Bart, how does this? How do the brokers get compensated for that work? Because I know that's a big, but a lot of brokers scratch their head saying, "Hey, I know we need to be more consultative, and the smart ones have always been more consultative. But at the end of the day, how do we get compensated for this extra work that we're being asked to do, for the benefit of our client?"
So you mentioned, consultative work, and that really is the key going forward. That it's really important for each broker to act as a strategic partner and to be consultative. Offering a wellness program and making a little bit off of a shared revenue with a wellness provider isn't really going to pad a broker's pocket. The real key here is protecting the relationship with the client, and then being able to maximize the broker's opportunity to move all of the products that are available in a convergence of typical fully insured health products and voluntary benefits, all that are going to benefit the broker's typical revenue stream and protect it from a defensive standpoint. The other key thing that I see here is that brokers that are still looking out the rearview mirror at how they used to do it are going to get passed up by brokers that are more progressive and much more consultative and can really take these solutions in a turnkey approach out to their clients.
Do we move to a fee-based program? Is that where it's moving?
I still think that at least in the near term, 3 to 5 years, there'll be some progressive brokers that get to consulting fee-based levels. But again, there's plenty of revenue for the broker if they protect the relationship and they get the penetration into their products that are important. The key is to make sure they stay progressive and on top of the cutting-edge products that are making a difference in today's market.
Bart, this is Brent. I know when you were in the industry with Active Health and then with Nurture, a lot of the health and wellness initiatives tended to live in the Fortune 500, Fortune 1000 universe. And now that you're focused down to the small and mid markets, how do you get a wellness program implemented into those type of companies, given the limited number of resources they may have?
Yeah, that's a good question. And, some of the things I noticed, with all the experience is that, employers are tired of being the safety net in the insurance world, but individuals are not so focused on personal responsibility, and that's been the big gap over the years. The key is that small to mid-sized companies have been slow to enact programs that can enhance culture and reduce costs. The key is to find solid platforms with the ability to collect and store baseline information, implement effective promotion and engagement efforts, and employ incentive and reward programs to drive participation. The key is that, while it's true big companies have seen a lot of success over time, it seems the small companies and the mid-market companies have been too busy focusing on running their company or building widgets and trying to make a profit to take all the steps necessary to start or sustain an organized wellness program. But, it doesn't have to be complicated. The key is to find the right mix of cost-effective outsourced solutions like health assessments, web portals, educational programming, and incentive management tools, but to then couple those pieces with internal resources that understand the culture of each group, that drive the promotional campaigns and administer the incentive programs that will resonate with each individual participant.
Yeah,
the key is to get support from program champions and company leadership along the way.
You talk a lot about the voluntary supplemental health side. You're talking about the wellness side. A buzzword in the industry right now is telemedicine, telehealth, and it's real. I mean, it's real as a cost reduction tool. It's real as far as some accessibility challenges. Talk to us a little bit about telehealth for the small to mid-sized companies.
Sure. So telemedicine offers around-the-clock affordable health care, 24/7 on-demand access to licensed physician. It's widely reimbursable. It's becoming integrated into the delivery systems of benefit offerings of major health plans and self-funded groups. The Affordable Care Act even specifically mentions telemedicine as a tool to improve the information delivery, to improve access and information delivery as part of a more cost-effective way to deliver care. Some of the top statistics, I don't know if people realize, but, the top 3 reasons that people go to the emergency room are sinus, ear, and upper respiratory infection, all of which can be diagnosed and treated with, prescriptions via telemedicine. Average call response time is 20 to 30 minutes, so about as fast as you can get to a doctor or an emergency room, you're already on the phone talking to one. Consultations are 14 minutes. Average time with a doctor today is only 4 to 6 minutes, so you're getting some quality time over the phone or chat with a doctor.
And I think you said it well a little earlier, Bart. It said, telehealth, telemedicine is not the end-all, be-all solution. It's a part of the toolkit, correct?
It really is. It supplements the efforts that you can do with wellness. It's just one more piece of the puzzle. The whole idea is to redirect care away from costly services that hit, self-funded health plans. An emergency room visit cost of the health plan, well, it might be a $100 copay or $150 copay. The cost of the actual health plan is over $1,000. Same thing with urgent care. Might cost the health plan $350, even though it might be a $50 copay. So telemedicine is a very, very cost-effective way for 70% of the things that people are going in the emergency room or urgent care for.
Bart, I want to give you. We got about 30 seconds left on the program, and I do want to give you time to kind of give our audience one last takeaway and let them know how they can find you. But also did want to mention to our audience that Bart will be working with us on setting up a telemedicine workshop at the conference. So that will be interesting. More details will be on the website there. But Bart, let our audience know how they can find you and give them kind of one good takeaway.
Sure. So you can find me. My website is www.GoFirst1. That's GoFirst1.com. My email is bart@GoFirst1.com. And I'm looking forward to working with you going forward. In terms of takeaways, just the bullets. Wellness program success depends on your approach. So you have to make sure that it resonates with each participant. So what I mean by that is if you make it meaningful to me, I'm more likely to stick with it. I want people to understand that telemedicine provides a valuable service. It's convenient. It saves costs. And I think that the key point is a broker should be utilized and leveraged in the overall benefit design process.
Well, Bart, thank you so much for joining us today on the program. Hope you have a wonderful weekend up there in Ohio. And to the rest of our audience, this is Brent and Doug signing off. Till next week.
See you next week.